CarePlus provides full non-medical caregiving services to Southern California.
Compassion and excellence in home care service makes CarePlus the best choice.
The CarePlus team of specialists provides assistance with daily living needs.
At CarePlus, we put our hearts and minds together to match the best caregiver with you and your loved one.
Being able to sleep and knowing my mother's safe and being properly taken care of, it's given me peace of mind.
At CarePlus Home Care, we recognize the value of every person.
Well, Roland is back with us today of CarePlus Nursing Services. Nice to see you.
Hey, nice to be back. Thank you, Ken.
Today you wanted to talk about dementia, and often that either gets confused with Alzheimer's, or sometimes it could even be maybe the beginning stages of Alzheimer's. So maybe you can kind of explain the differences and the stages of dementia.
Okay. Dementia is quite a fascinating issue. It's not really in itself a disease process. There's usually other issues that cause dementia. A lot of people think that once they have forgetfulness, they have dementia, but in all honesty, it's not really quite correlated that way. Forgetfulness is part of dementia, but dementia is not part of forgetfulness.
Okay.
The thing about dementia is that about 20% of dementias can be somewhat cured because of the associated problems that tag along with it. About 50% of the other issues that have dementia, though, which is the Alzheimer's kind, are the kind of dementia that really can't usually be managed directly with medication. It's usually managed through other means to try to slow down the progression of the disease process. So all in all, the disease of dementia, well, dementia is not really, like I said, it's not really a disease, but dementia in itself creates an avenue where, although we think that there's really nothing we can do to help alleviate some of the issues, we can actually do something to help make it better for not only the individual, but for the family members that are involved with the care. You asked me a little bit about the stages of dementia, and there's multiple grading scales that are out there. Some of them are simple to read, and some of them are very difficult. Some of them will stage them from 1 to 7, and some will stage them a little bit more generally. And I choose to kind of really categorize them a little bit more generally because dementia affects people very differently in a very unique way. Like sometimes you'll see some family members who'll say, "Oh, but my mom had this, and it was like this is how it happened for her," and they compare it to their sister. There's absolutely no way that you can kind of really say that one person's way of managing through or progressing through dementia is exactly the same way as the next person. So, but you have the mild progression, which usually when we start saying, what is that word, or you forget certain small items, like even during conversation, you forget that you've mentioned an item or a story. When you get into the moderate or the moderate dementia, that's when you start to see some significant changes. And this usually when you get into the moderate stages, when the family members start to recognize that there are problems that are occurring or that are progressing within their loved ones or their friends. And when you get into the severe stage of dementia, usually at that point, it's some amount of outside assistance or some resources are required to really help take care of these people.
How do you know, how would a family member or even someone such as yourself know what is it dementia that's coming on, or is it Alzheimer's? And can dementia also be described as somebody who maybe thinks my neighbors are staring at me all the time, or things like that? Is that part of dementia? You know, they think things are going on around them that aren't, versus Alzheimer's we usually associate with maybe loss of memory or loss of their whereabouts. They're not in the moment. They're not present in the moment.
Okay. The brain is uncanny, and it's to me the greatest tool that's ever been built. But when it's affected by some of these disease issues, that it becomes a problem. But you know, we're divided into different parts in our brain. We have the frontal lobe, we have the parietal lobe, we have the temporal lobes, and the occipital lobes. when each part of this lobe is affected, like for instance the temporal lobes, which are on the side, a lot of the issues that can arise from that are memory issues. And not only the memory issues, it also has emotional, and some of the anger, happiness centers are located in the temporal lobe. A lot of the other issues that can arise are in the frontal lobe, which is more for personality. So you kind of mentioned about like some people actually have that fear, like somebody's watching them.
Right.
That's some of the issues that can arise from having some of these lobes being affected by the disease process, is that you can develop delusions, hallucinations, and these are things that basically we have to manage in a positive way, especially if you get into somebody who has mild or severe dementia. Having these delusions or hallucinations will really have to be managed in a very tactful and positive, effective way. The delusions are more like exactly what you described, more like somebody's watching them, or somebody's coming into their room. Those are essentially things that we need to help manage through. Sometimes you can't take them out of their delusion, but you actually enter the delusion with a way to distract them away from it. Like for instance, somebody says, "Oh, there's a spider on my," somebody's coming in to get he's been taking money from my wallet. And what you do is you actually kind of work through it, where you can maybe put the wallet in a place that they can see a little bit more. You can kind of document what's in the wallet so they know what's in it. The hallucinations, of course, are like if they say, "There's a spider in my bed," you walk in there and you actually maybe move the beddings and clear the beddings. And those are things that can help allow them to realize that there's nothing really going on in a very careful and, I guess, caring way.
Yeah. And so that is the differences with in Alzheimer's. You usually don't have that type of thing, do you? Where they think something's going on around them. Isn't it more associated with they're just they're losing contact in their own mind of people they once knew, places they once have been, and they're just kind of drifting away versus thinking that something weird is happening around them.
Because like Alzheimer's and dementia, they're all very pretty much correlated to some degree. The people with Alzheimer's will also exhibit some of these problems as well. The difference is, of course, like you had mentioned, it's a little bit more progressive. It's a little bit more not predictable, but you can almost see that from point A to point B, this is likely to occur and happen. They do still have the delusions. They also have the hallucinations, and sometimes too, they also have what they call sundowning, which is early in the morning they're fine, and then it comes down to the afternoon, they start to lose even more abilities to manage for themselves. They're unable to really control their emotions. They get a little bit more frustrated, and these are things that we can help try to find ways to actually also help alleviate their struggles. And how you can do that, like in regards to like with my area of expertise, which is home health, we're very trained in assisting caregivers and family members how to keep people mobile. Keeping people mobile keeps their brain a little bit more active, a little bit more in tune to what's going on around them. When they start to lose that ability, they get more frustrated, they start to decline even quicker. We can also go in there and give them some equipment that can help them manage their day a little bit better, not only for the actual patient, but also for the caregivers. And then, so there's essentially a lot of things that we can do. We try to help them arrange the home, because even like simple things as music or loud noises or light, bright lights can also trigger some of these untoward problems from dementia.
All right, very interesting. Well, Care Plus Nursing can certainly aid you in that, and a lot of other services that they offer as well. Their number's on the screen, 421-3686, careplusnursing.com, and you have a whole host of different things that you folks offer in different stages, and whether or not they need somebody there for a short amount of time or not, you have that all offered through your services.
Correct. We do have the home health, the hospice care, the home health, home care, hospice, home health, and outpatient therapy very soon.
All right, very good. Well, good to see you again, Roland, and have a good holiday.
Great, thank you.
Thanks
Kevin.
for the
Okay,
information.
thank you.
We'll be back in just a moment.
CarePlus Home Health is dedicated to providing personalized and compassionate care in the patient's home setting.
Whether you need the skilled care of a nurse following a hospital stay or just a little work with a therapist, CarePlus Home Health is there to assist.
We have a variety of specialty programs, including palliative care,
CarePlus Home Health, delivering professional care with a personal touch. Call us today